minutes.
Thank you for the opportunity to speak on this bill, which, without doubt, will have a positive impact on many families in Ireland. A lot of consumers have the tendency to believe that if a product is on the market, it is deemed safe. This assumption is wrong, and it is our job to have laws in place that protect our citizens. We all know the dangers of tobacco and alcohol, and over the years, new legislation has come into place in order to protect people, especially children, from the harmful effects of these substances. It is widely known that most forms of ultraviolet radiation contribute to skin cancer. The main contributors of ultraviolet radiation are the sun, sunbeds and sun lamps. Over the years, the use of sunbeds has become more and more common among Irish people, attributing to a variety of medical conditions, with skin cancer being the most serious and dangerous one. The research published in the British Medical Journal reveals that 794 people die each year in Europe from sunbed-induced skin cancer. In Ireland, the situation is even more serious, with 158 deaths from skin cancer in 2011 alone. In up to 90% of cases, the cause of cancer is mostly the exposure to one or more cancer-causing factors. The majority of people are aware of the dangers that a prolonged exposure to the sun can cause. Yet many still choose to use sunbeds for cosmetic purposes, not knowing that the intensity of the UV rays of some sunbeds can be as much as 5 times or even more times stronger than what we would get from the midday sun. People need to know that using a sunbed is most definitely not a safer way to tan. Lack of regulation of the industry only makes the situation even more dangerous, with the information on the number and standard of suntan studios hard to come by. Studios have shown a lack of public knowledge about the health risks from the use of sunbeds. The main reason people use them is in order to have an all-year-round healthy look, not knowing about or dismissing the dangers and health risks that come with it. I am aware of some people, mostly women, who engage the services of a tanning saloon for a period of 2 weeks before they go on a 2-week sun holiday. One can only imagine the damage done if this is a yearly practice for some people. Sunbeds are more dangerous for some than others. People who have a frequent sunburn history, large number of moles, or a family history of skin cancer are more likely to be diagnosed with cancer. It is also widely known that people with fair skin are more likely to get sunburn and as a result have a higher risk of developing skin cancer. Protection of the citizens is a priority of this government, and we have to spread the knowledge and, where necessary, use the powers of the law in order to make sure that people's health is being protected. That's why I strongly believe that the bill should prohibit people with a fairer skin, referred to as type 1 or type 2, from using sunbeds. The Irish Cancer Society, the World Health Organization and the Environmental Health Officers Association all agree that no one should use a sunbed to get a tan. In fact, the World Health Organization has classed sunbeds along with cigarettes on a list of the most cancer-causing substances. The current Fianna Fáil leader and former Minister for Health took a bold step some years ago in prohibiting smoking in public places, including the workplace. And this bill will be forever seen as one of the most innovative pieces of legislation that will protect people's health against the damages of passive smoking. This bill is as important, and that one of our quests to tackle bad practices that lead to cancer disease, and will be seen in years to come as vital in reducing cases of skin cancer in particular. Some of the proposals contained within the bill that I warmly welcome include the control on the remote sale or hire of sunbeds, and that tanning saloons provide training for staff, and that inspections can be carried out by the HSE. Education to the dangers of overexposure to sunbeds is paramount, and the decision to have warning signs displayed on all sunbed premises, alongside the prohibition of on promotional marketing practices and the requirement on operators to ensure that sunbed users are made fully aware of the potential dangers of sunbed use, and that they are given an opportunity to read the health information form and sign before they use the sunbeds is very welcome. Overall, I most welcome the decision by the Minister to prohibit persons under 18 to use a sunbed in tanning saloons and to prohibit the use of sunbeds in unsupervised premises. It galls most people to see little girls, many under 12, spending hours in tanning saloons before the first Holy Communion or confirmation ceremonies. Apart from anything else concerning the fact that this is a religious occasion, it is sad that some parents in our society today would be so reckless as to encourage their children to partake in such a vanity exercise and to ignore all the health implications. Finally, I want to congratulate the Minister for introducing the bill, and indeed all parties in the House for their support of this bill, which is very timely.